Cervical cerclage, also known as a cervical stitch, is a surgical procedure to place strong sutures around the cervix to keep it closed and prevent premature birth or late miscarriage. It is recommended for pregnant individuals with a weakened cervix, history of cervical surgery, or a history of recurrent miscarriages. It is a temporary measure to help the cervix hold a pregnancy in the uterus. Elective cerclage is usually performed between 12–18 weeks. Emergency and urgent cerclage may be placed up to viability, but are rarely used after 24–28 weeks. A cervical cerclage procedure itself is not painful because it is performed under anesthesia. After the procedure, it is normal to experience mild pain, cramping, and spotting for a few days. Similar to a menstrual period, you may also feel a burning sensation when urinating. If you experience intense pain or heavy bleeding, you should contact your doctor immediately. After the procedure, pain, mild cramping is normal for a few days, and you may have a burning sensation when urinating. Bleeding, light spotting or bleeding is common for a few days after the procedure. Discharge, you may notice a clear or whitish vaginal discharge. Management, your doctor can provide pain relief medication to help with discomfort. Rest for a few days, as advised by your doctor. Avoid heavy lifting, strenuous activity, and sexual intercourse for about 10 days or as directed. Contact your doctor if you experience severe pain, heavy bleeding, or other concerning symptoms. Types of cerclage. Transvaginal cerclage. This is the most common approach, involving placing a suture through the vagina. McDonald cerclage. A purse string suture is placed around the cervix without extensive bladder mobilization. Cervical cerclage. A more complex procedure where the suture is placed higher on the cervix, requiring mobilization of the bladder. Transabdominal cerclage. Reserved for cases where transvaginal cerclage is not feasible or has failed. A suture is placed around the cervix via an abdominal incision through either laparotomy or laparoscopy. This can be done pre-pregnancy or in the first trimester. Classification by indication. History indicated. Performed as a preventative measure for those with a history of preterm birth, typically between 11–14 weeks of gestation. Ultrasound indicated. Performed when cervical shortening is identified during a transvaginal ultrasound, most commonly between 14 and 24 weeks of gestation. Emergency or rescue. Performed when the cervix has already begun to open and the membranes are exposed.